Good afternoon, ladies and gentlemen. We welcome you here from the day one of Arab Health and its 50th anniversary. Today, we are so pleased to have Mr. Mucci from Bioscience Labs in Dubai to introduce us to the stem cells and stem cells technology. Welcome, Mr. Mucci.
Hi.
We are very pleased to have you today.
Nice to meet you. Thank you.
Can you please start with a brief introduction about you and your work?
My company and me, we were started 20 years ago in Italy. Mm-hmm. We did the first cell factory in 2005 in Italy for the stem cell from cord blood and mesenchymal stem cells. In 2013, we opened our cell factory here in Dubai. And since 2013, we have our laboratory for the extraction of the stem cells and expansion. 11 or 15 years ago, nobody knows about the stem cells.
Yes.
Now the awareness is very good and the application is huge. There are a lot of different applications that our reputation is going to be very, very important.
Now the question is, because we still have a big debate about the stem cells and the application of the stem cells. So could you please give us a brief on what is stem cells, where can we get them, and how can we use them in patients?
First of all, we have to consider that there are two kinds of stem cells. It's very different, very important. A lot of people know the stem cells from cord blood, but the stem cells from cord blood are good to treat just the blood disease, the blood cancer. And these stem cells have the problem of compatibility. You cannot switch from different people.
Patient to patient.
Exactly.
Yeah.
The stem cell from fat is the mesenchymal stem cells, are good to treat not the blood disease, but any degenerative process of the organ and tissue. You can treat the skin, the joint, the bone, anything of the body. These stem cells don't have the problem of compatibility, and you can shift with the different people. The stem cell from fat, the mesenchymal stem cell that we treat, have one very important indication. One is to treat the aging process or degenerative process of the organ and tissue. Mm-hmm. From when we born, after we start to have our degenerative aging, and we can reduce the process of aging using the mesenchymal stem cells. We cannot treat the disease, but we can treat the degenerative process related to disease or related to the aging. Mm-hmm. I give you an idea, the skin aging. You can see that the skin aging have the expression is the wrinkle.
Yeah.
You can treat the wrinkle using the filler. But
that's the only process we have nowadays.
You don't treat the aging. You treat also the symptom of aging, that is the wrinkle, but you still have all the skin without a wrinkle.
Yes.
If you want to treat the aging of the skin, you have to know that the consequence of the aging is the aging of the cells of the skin. The cells of the skin are called the fibroblasts and the keratinocytes.
Yes.
When these two cells start to be old, the collagen and elastin that give a young aspect to the skin are not more produced, and we have the wrinkle. When you inject the stem cells in the skin, you replace the old cells with the new cells.
So like making a regeneration for the cells.
Exactly. And new cells start to produce collagen and elastin, and you will have improved the texture, and then you can have a young skin without wrinkles.
Okay, now speaking about that process you have mentioned, is there like any age limit for using the stem cells?
No, there is no age limits. Can be used at any age. This is demonstrated for the last trial that was published. It was COVID, where was very interesting because when there was the COVID page of every old people with COVID, they were treated with the stem cells in IV systemic, and the result was very, very good. It means that you don't have to consider that because patients are old, the stem cells don't have a function. Maybe you have to use more cells, because it's very important to know that we became old when the stem cells reduce their concentration in organ and tissue. So the quantity of the stem cells is more important than the function, because the quantity is the indicator of the aging.
Now, when we speak about the age and treating the aging or something like that, is there like any solution for treating the age-related diseases using the stem cells?
Yeah, any kind of age-related disease are the consequence of the aging process, and that is the consequence of degenerative process. Degenerative process is related to what? The inflammation of the body, immune system deficiency, when our immune system is weak, when in our body there is huge inflammation, where our good bacteria are not in balance. What happens when you inject the stem cells in the bloodstream? The stem cells reduce the systemic inflammation, improve the quality and the function of the immune system, and give a balance of hormone, and replace the old cells with new cells. When you make this kind of treatment, you reduce the speed of the aging and you delay the process of development of the age-related disease.
Right, which will be like optimistic for so many people. Now, as an expert in this field, where do you see the future of the stem cells?
The future of the stem cells will be the optimization of the cost to help everybody to be able to use the stem cells.
So make it available for everyone.
To create affordable. But the industrial scale-up is very difficult because the stem cells, when are autologous, for you use yourself for yourself, is a tailor-made product. You need 3 weeks of culture to expand for one patient. And to make the industrial scale-up, to reduce the cost, is very, very difficult.
Mr. Mucci, we are so pleased to have you today, and hopefully we can see a brighter future. Thank you very much.
Thank you so much.
For your time.
Thank you for your time.
Our dear viewers, we have reached to an end to our interview with Mr. Mucci. Hopefully stay tuned for upcoming guests. Stay tuned for Arab Health 2025. See you later.